This is a delegation question. So delegation I always found to be kind of challenging, right? I feel like it's a lot to remember. So let's take a look at this one and see what we're being asked. So we have a charge nurse who's supervising a registered nurse in the care of a client on a mechanical ventilator. The charge nurse should intervene if the RN asks the unlicensed assistive personnel to do which of the following tasks. So again, this is kind of a mouthful. We need to read it really carefully. And so we've got like 3 people in this question, right? We've got a charge nurse, we've got an RN, and we've got a UAP. And we're being asked which of the following would be inappropriate to delegate to the UAP, right? So we're looking for a task that would be inappropriate to delegate. Okay. So before we read our answer options, let's take a look at our 5 rights of delegation so we can kind of refresh our memory on what we know about this. Okay, so first, when we're delegating, we have to make sure that we're delegating to the right person. So in this case is the UAP, since that's what we're talking about in this question, but it could be an LPN too. Are they competent to do this task? Do they have the skill? Do they have the appropriate knowledge and experience to do this task? Okay, and then we need to say, is this the right task? Most importantly, is this within the scope of their practice, right? That's a biggie. Is it a routine task with an expected outcome? And is there minimal risk to the client, right? Because as the nurse, we're always responsible for the tasks, even if we're delegating them, right? And then is it the right circumstance? So is this client stable? So an example I like to use for this is think of client transfers. So UAPs help with client transfers all the time, right? They move clients from the bed to the chair, vice versa. But say if it was a client who was just freshly back from a total knee replacement and it was the first transfer, would that be appropriate to delegate? No, because that client would not be considered stable until the nurse has made that determination. So the nurse would need to do that first transfer, assess the client, determine they're stable, and then the UAP could do that after that. Okay, is it the right direction and communication? So does this UAP understand what we're asking them to do? Do they have any questions? And do we have the right supervision and evaluation? So are we able to evaluate if the task was performed correctly? Are we able to evaluate the outcomes of the task that this UAP completed? Because remember, as the nurse, we're responsible for that task, even though we're delegating it to somebody else. So we want to make sure that we can evaluate the outcomes. Okay, so let's go back and remember, we're looking for the task that would be inappropriate to delegate to the UAP. So let's take a look. Would it be inappropriate to delegate the UAP to turn the client to the left, from their left to the right side every 2 hours? Would that be appropriate? Yes, right? Like they should have the skills and knowledge to be able to do that. It's within the scope of their practice. UAPs do that all the time. Position changes, right? We want to maintain skin integrity. We can evaluate that because we're going to see that they've moved from the right to the left. So that seems appropriate, right? We have no reason to think that that isn't. Okay, let's look at number 2. Notify the RN when the client requires inline suctioning. What do we think? Well, I think we need to ask ourselves, how would the UAP know when the client requires inline suctioning? They would have to do an assessment, right? They would have to maybe listen to lung sounds, O2 saturation, and they'd have to interpret what that means. Is that appropriate to delegate? Can we delegate assessment? No, right? That is not within the scope of practice for a UAP. So I would be concerned about delegating this. So let's look at our other options though, just to make sure we haven't missed anything. All right. Can the UAP perform passive range of motions exercises on extremities? Is that within the scope of their practice? Yes, I would say so. And as a UAP, they should have the skill and knowledge to be able to do that. We can evaluate the outcomes, right? Because they should be able to maintain range of motion, right? So we can see if that was successful. So that I'm not too concerned about delegating that. And then lastly, measure the client's respiratory rate and pulse oximetry reading. Can we delegate that? So I think sometimes where students get tripped up with this question is between these two. So let's look at the differences. So what is the difference between notifying the RN when the client requires suctioning and measuring the client's respiratory rate? So measuring the respiratory rate and pulse oximetry is data collection, and that is within their scope of practice, right? They can write those numbers down. but are we asking them to interpret what those numbers mean? So here, they would have to interpret those findings, right? So here in number 2, to know if the client required suctioning, they'd have to interpret that data. Number 4, we're just asking them to collect that data for us. Do you see the difference? Okay, so what do you guys think? I'm still liking number 2, right? Would be inappropriate to delegate. So let's check our answer. And yes, we got it correct.